Some banks focus on transactions. At Rockland Trust, we focus on people. Relationships come first because financial success isn't built in a single meeting or a single moment. It's built over time by listening and showing up, by being in your corner through every stage of life or business. Come bank where your relationship matters. Rockland Trust, where each relationship matters. Member FDIC. We're talking about the issue of postpartum depression on this episode of Kerrigan and Company.
Kerrigan and Company is here for you. Yes, Kerrigan and Company is here for you.
Welcome, everybody, to Kerrigan and Company. I'm so glad that you could be with me today on a show that's really important. And I hope that when this show is complete, that we all learn something new about a very, very important subject, and that's postpartum depression. Before we get started, I want to let you know, number one, I don't have a co-host today. We wanted to spend more time with each one of our guests, so we made the decision not to have a co-host. And number two, and this is just a little bit of housekeeping, if you are watching us on YouTube or, of course, listening to us on any of your favorite platforms, we hope that you will hit the like button and you will subscribe. We would very, very much appreciate that. You know, the CDC estimates that about 1 in 8 women, that's nearly 13%, who recently gave birth, reported symptoms of postpartum depression. With roughly 3.6 million births in the U.S. this year, that means 1 in 8 translate to approximately 450,000 women each year experiencing some kind of symptoms of postpartum. So we know that this has been in the headlines of late, and we decided that we thought it would be an important subject to take a look at and to learn more about. We're going to begin this conversation with a doctor that is board certified by the American Board of Obstetrics and Gynecology and a fellow in the American College of Obstetrics and Gynecology. I'm so happy to have joining me today Dr. Donna Adams Pickett. Doctor, thank you so much for being a part of the show.
Thank you for having me on for a very important topic.
It really is an important topic. And, you know, we said that it's been in the headlines of late, but this is a subject that I feel confident you deal with in your practice on a very regular basis.
Yes. Unfortunately, but again, we just don't have the discussion in a broader sense for everyone.
Sure, absolutely. Well, let's get started with me asking you a little bit about when a couple comes into your office and they sit down and they say that they're feeling completely overwhelmed. At what point do you figure out this is maybe not baby blues, but instead this might be postpartum depression?
Well, you know, what's interesting is that I try to actually have that conversation even before they deliver, particularly if they have had a history of depression, what I call peripartum depression. But before they go into delivery, they're starting to become a little anxious about the fact that they're going to be a new mom, anxious about, is there going to be pain associated? What are my next steps? And so I try to prepare them for what may happen to them after delivery and how it may take a turn to the point where they question their very being. And then we then have that conversation about postpartum depression.
Absolutely. Postpartum depression, I mentioned baby blues. So I think there's really 3 categories that maybe you might explain for us. There's baby blues, there's postpartum depression, and then there's postpartum psychosis. Can you explain what each one of these are?
So baby blues are just the mild, I'm a little sleepy, not sleeping well, and I may not be the happiest person in the room, but I'm still quite engaged in life. And engaged in what's happening with me, just may not be the life of the party. That's your baby blues.
Sure.
Postpartum depression is when you have difficulty waking up in the morning. You're not tired. You just don't want to get out of bed and start the day. You have some feelings of anxiety. You have those feelings of, I don't know what to do next. Am I doing the right thing? Little interest in eating and participating. in life. And then there's postpartum psychosis. And with psychosis, that is when there are ideas that are associated with harming yourself or others. And those ideas seem the most logical thing to you because delusions are telling you that these things should be done. And that is when we're facing the postpartum psychosis.
Well, there's a lot of fear around that word psychosis, and for good
Yeah.
reason. If we have moms who are listening right now and they are unsettled with their thoughts, talk to us a little bit about what they should do, the steps they should take, and how you would make them feel safe had they come into your office.
Well, one of the things that I do and most hospital systems should be doing is doing a screening just before mom is discharged, and see where mom scores on that in terms of her risk for severe depression. But one of the things I would like to see us do in our industry is that we typically do a postpartum check at 6 weeks post-delivery. And I would like for the system to allow us to have those checks sooner, maybe 2 weeks after delivery, 4 weeks after delivery, and then another at 6 weeks. And at the beginning of those visits, let's focus more on how are you mentally and emotionally coping with this new experience, because it's like being thrown into a foreign country and you don't speak the language, you don't know the customs, you're not acclimated to the climate. It's a lot for you to adjust to, and our mental response is to shut down. So when you feel, as a mom, if you're listening, if you feel that this should be the happiest time in my life, and right now I feel like it's the most miserable, know that you can get assistance with that. You just have to be willing to have that conversation.
Give me a timeline, if you will, again, with these three different, things that we've talked about: baby blues, depression, and then psychosis. Give me a timeline. How quickly would one see these kinds of symptoms for each?
You can see them as soon as a week after delivery.
Okay.
And it can be progressively over that initial 6-week period, but then this whole thing could really go on for up to a year after delivery. And so that's the one thing I want people to realize, because a lot of times they think, well, I had my 6-week postpartum check. The doctor told me that physically I was okay. But emotionally and mentally, you can still be adjusting for up to a year post-delivery. And, you have a baby that's eating finger food and you're thinking, okay, I should be okay now.
Right.
Which you may not be. And it's okay to have that conversation with your care provider.
Well, and how do you get that conversation started, doctor? Because I think there's a lot of parents out there who actually are embarrassed about this kind of thing. They don't want to admit that this is happening. Maybe it's dad watching and he knows that something's different about his partner, or it's mom who doesn't want to admit that she's not elated that this baby has arrived.
So, what I love about conversations like this is that we're normalizing us even having these discussions. And so, at least with my patients, and I really want everyone to do this, as you're preparing for delivery, you're preparing a baby bag, you're preparing a crib and a nursery, you really need to start preparing for, how do I take care of myself physically and emotionally post-delivery. I mean, actually prepare for it. And when hey, I'm not quite myself, put your little deputies in place. When you see me not participating the way that I normally do, I need you to alert me, to alert my clinician. And most of us are trained to recognize those signs. I mean, I have patients come in for their postpartum visit, and I'm like, hey, you're just not quite yourself.
Sure. Absolutely. Let's talk a little bit about postpartum hormone crash, I think is what it's frequently called. So what's actually happening in a woman's body when she starts to feel all of these unusual feelings?
Well, now, what I like to do is make it relevant to your period. Okay.
Okay.
Because everybody may not have had a baby, but they have had a period. And so what allows you to have your monthly period is a drop in your hormone levels. I mean, otherwise you have your period every day. And so, we have to have these on and off buttons of your estrogen going to a certain level, progesterone going to a certain level, and then dropping. So likewise with pregnancy, you don't make placentas all the time. So you have to have an ability to develop a placenta, have that placenta come out, uterus go back down from the size of a watermelon down to a lemon, heart decreasing by a third of its size. So you have to have on and off buttons.
Sure.
And when those buttons turn off, you feel the crash.
Mm-hmm. Absolutely.
And so just like you have premenstrual syndrome because the estrogen and progesterone levels are dropping, you are going to feel that drop in those estrogen and progesterone levels.
Mm-hmm. So, I mean, something physically, obviously, is happening to women. Something else that's happening to women, and I think a lot of people like to blame the blues or blame the depression on this, and that's sleep deprivation. And, I remember I have 2 children, and someone said to me before I had my first, nobody dies from a lack of sleep. But let me tell you, nobody's happy with a lack of sleep either. So let's talk a little bit about, how important sleep is for new parents.
Listen, this is what I tell patients all the time. If you speak with any military CIA specialist, they will tell you the first thing they do with prisoners of war is deprive them of sleep, because they recognize that your defenses will be crashed. You'll say whatever you want to say. You'll do whatever they want to do because of that sleep deprivation. Nothing is working well when it's on all the time. Even my computer, I have to turn it off sometimes in order to get it to function properly.
I love that comparison, and you are so absolutely right.
Yeah.
We've talked about these different states, and I know that especially if someone is suffering from psychosis, there are drugs, and there are drugs for those who are actually suffering from depression. But what about those parents out there who are saying, I'm going to breastfeed my baby, and I don't want to be taking those drugs because that might interact with my baby. So now here's a conflict. What do you do about that?
Well, the thing is, there are some that you can take while breastfeeding. We have not seen any adverse responses in babies who have ingested these medications or metabolites from these medications, and usually it's very small amounts. So it's just with shared decision making with your clinician to find that one that works while you're breastfeeding, because there are some available. But more importantly, if you are not in your best state, that's going to affect your milk production. That's going to affect your ability to nurse your baby properly. So we do have to make sure that you are doing well.
Sure.
And that may take some medication. Absolutely.
And there are some exciting, fast-acting medications out there on the market now, correct?
Yes, there are.
Because for the longest time, a mom would have to take these medications and then wait a period of time for them to be activated, right?
Right. But many of them now, within 7 to 10 days, you're usually feeling some better. And I strongly recommend that whenever we start a patient on these medications, that you see someone within 7 days of beginning so we can make sure that it's working well for you.
Sure. So, doctor, let's back up. And once again, so baby blues, pretty much that's let's talk through it and we can make this be okay, and let's try to get you some extra sleep and maybe somebody who comes in at night, right?
Yes.
Depression, is it frequently treated with medication, and can you get to the other side of that?
Absolutely. Medication and talk therapy. Finding a therapist who is trained with new moms, postpartum moms, and so those two together work very well.
And in psychosis, what needs to be done?
With psychosis, we often may need an inpatient hospitalization. We need to use higher dose medications and close monitoring to ensure that mom is not a harm to herself or those around her.
Yes. And can one recover from psychosis, or does this kind of psychosis stay with a mother then for the rest of her life?
mom can absolutely recover from this. Absolutely, with careful treatment and careful monitoring, it can be just an unfortunate season for her that she'll be able to look back on.
Absolutely. Doctor, anything that I haven't asked that I should have asked you?
You haven't asked, you asked great questions. I just really want to normalize this discussion.
Right.
So prepare for not feeling your best self emotionally before delivery, the same way you would your baby's nursery.
Sure, absolutely. I think that's the most important, one of the most important things. Again, as someone who has had two children, my OBGYN was kind enough to talk to me about this beforehand. So I sort of had some ideas about what might be coming down the pike. And I do truly believe that made a huge difference for me and for my husband.
Absolutely.
So
absolutely.
Yeah, so if you're a mom out there and you're listening, broach that subject. Don't be afraid to do so, right?
Yes. And get your support team ready for you to help you afterwards.
It does take a village.
Yes.
Doctor, thank you so much. It has been such a delight to have you. I can't tell you. And you have normalized this and made, I think, a lot of moms feel pretty good about it. So thank you very much.
Thank you. You take care.
Thank
Have
you.
a great day.
Thanks. You do the same.
Bye-bye.
All right. Stay with us, everybody, here on Kerrigan and Company. When we come back, we're going to speak with a woman who herself was a patient with depression, and we'll talk about her experience. This is Kerrigan and Company. Banking shouldn't feel transactional. It should feel personal. At Rockland Trust Bank, we take the time to get to know what matters for your business so we can support what comes next, not just today, but for years to come. Because when you have a banker who knows your business, understands your goals, and sees your vision, that partner can make all the difference. Come bank where your relationship matters. Rockland Trust Bank, where each relationship matters. Go to rocklandtrust.com for more information. Member FDIC.
If you think a musical can't rock, think again. With the hits of Whitesnake, Styx, Journey, and more, Rock of Ages will rock your summer. Now through August 23rd at Bill Haney's North Shore Music Theater. Tickets at nsmt.org.
Welcome back, everyone, to Kerrigan and Company. So glad that you could be with us today. We are talking about something very, very important and something that's grabbed a lot of attention in the headlines of late, and that's postpartum depression. I am very pleased to have with me our next guest who suffered with postpartum depression twice, and she is sharing her story because she wants to make sure that other new moms don't have to go through the same thing that she has. I'm happy to welcome Amanda Kriebel to the show. And Amanda is not here in the Boston area right now, but grew up right here in the Boston area. And it's lovely to see you today. Thanks so much for being a part of the show.
Thank you. Thank you for having me.
You have two babies.
Mm-hmm.
You were telling me off the air 4 and 1, correct?
Correct.
Yeah, absolutely. Let's walk back to your oldest, which is, I know, your daughter, and talk a little bit about what happened when she was born, and maybe you could walk us through some of the steps that happened from the time she came to the world.
So with my first, I don't think I recognized that I had postpartum until the second came along. With my first, I had a bit of a traumatic delivery, and I was kind of chalking it up to being in a bit of a state of shock from that. And then also the shock of being a new parent, and just kind of swept all those feelings under the rug a bit. And then, around like that 6-week mark, those feelings kind of lifted, and I really never thought about it again until my second came along. And so that's really what made me kind of look back and realize, like, oh, that was postpartum depression. And with him, it was vastly different. It was just a lot more severe. One of the first things I noticed is that I had no desire to eat. And let me tell you, your girl loves to eat. I gained 60 pounds with that pregnancy, and food, I have a lot of comfort in food. And he came into this world and was healthy, and I actually had a great delivery this time. But I couldn't feel feelings. I couldn't feel love. I couldn't feel pleasure, desire, anything. It was just, I just had this flat affect. And Um, about a week in, I went ahead and said, you know, this this is more severe than it was last time, so why don't we just go ahead and nip it in the bud? And I actually had scheduled a telehealth visit with a psychiatric provider who I was already established with.
Mm-hmm.
Um, so we did that video call. I told him what was going on, and we said, let's go ahead and get an SSRI on board.
Mm-hmm.
And so that happened. I started taking the medication, knowing that it can sometimes take 4 to 6 weeks to kick in.
Right.
I also happen to be a pharmacist, so
Right.
he kind of lets me direct therapy a little bit because I know those things.
Right.
And then I didn't have my 6 week post-op appointment. I didn't see my OB again until my 6 week post-op appointment.
Mm-hmm.
And at that time, I had told them, I've already started an SSRI. It hasn't done anything for me yet. You fill out the little survey.
Mm-hmm.
You fill out the survey, saying all your different symptoms, and the provider wanted me to try switching my medication at that time. And initially I said, okay, let's try it. I reached out to my psych provider and said, you know what, this is what my OB wants to try. I think it's logical. He was on board with it. But it was at that time I kind of put it on his radar that I may want to consider another medication that's specifically for postpartum depression.
Right.
And that's called Zurzuvae.
Mm-hmm.
And so I just kind of put it on his radar. God bless his heart, he had never even heard of that medication, nor had my OB. So that was concerning.
Right.
And
Can I interrupt you for just a
Of
second
course.
and ask you a question about that?
Mm-hmm.
Do you think that the medication, because I know there's a number of medications that are coming out, and being a pharmacist, you would be much more aware maybe of some of those newer medications that take effect a little more quickly. Do you think it was the newness of the medication, or do you think it's that a lot of these doctors don't deal directly with this issue?
Both.
Both.
It is fairly new. I think it came out in 23.
Mm-hmm.
But also once you have your baby,
They send you out.
you're out.
Mm-hmm.
And not only do you no longer see, the doctor who you saw your whole pregnancy, you're likely going to see a mid-level at the practice, a midwife,
Sure.
a nurse practitioner, which I had no problem with, but they, at my specific office, were not educated, were not equipped. And the literal phrase that was said to me at my 8-week appointment was, I don't know what to do with you. And I felt so abandoned, but at the same time, I was like, I got this. I already am directing my own care. I've got someone else who is on board, and my psych provider. But at the same time, I couldn't help but think all of the women who were not in my position, who don't know how to advocate for themselves.
Right.
And I'm like, the average woman is coming to you with postpartum depression, and you say to her, I don't know what to do with you.
Right, right. Amanda, talk to me a little bit about how your family was reacting.
I mean, my husband did not know what to do or how to support me. I think, and again, I'm super lucky. I have a village. I have both my parents, my husband's parents locally. I had a ton of family support, but at the same time, it's such an isolating experience having a baby. You're up at night, typically, solo. In my situation, my husband had to get some sleep so he could take care of our toddler the next morning. I was primarily, the one doing the night shift. And it was extremely isolating. You know, you sit up late at night, you're exhausted. Like I said, I've barely eaten anything.
Right.
I'm barely drinking. I'm going from one caffeinated beverage to the next, and I physically could not have maintained that for much longer. But also, there is this stigma that you don't really want to talk about that. Um, you know, you don't really show that you're not super happy. Um,
So the
and
stigma was exactly where I wanted to go with this next, because I can only imagine that, that isolation
mhm,
was so difficult, and you didn't feel like you had a lot of places to go, because a lot of people want to say, hey, you're just tired, you just had babies, and
mhm,
you're going to be fine. And I'm not trying to put words in your mouth, but I can only imagine that that might be the reaction from some people.
absolutely. It's funny, you know, you see a mom or a new parent with a baby, and your first instinct is to just be like, oh my gosh, are you so happy? Are you so full of love?
Right.
And instead of saying, no, I'm not, you grit your teeth and you smile and you say, yeah, I'm so full of love. And because you don't want to, you know, people say those things as, you know, common sayings and
Sure.
typically are not interested in how you're really feeling.
Yeah, right, right. Can you remember a point that was like the lowest point? I mean, did it sort of do that rock bottom out, and then the medication caught up?
Um, for me, I never had really a rock bottom. I just was like in this cycle day to day. Um, at that point, you know, I was on my second antidepressant. It still wasn't working. I had my psych provider working on getting me the Zurzuvae medication, which is a whole nother obstacle in itself. And it was just like this cycle of wake up, care for this child, keep him alive, and try and get some sleep. I didn't eat, I didn't drink,
Right.
I didn't do anything. Um,
Could you
I wasn't
bond? Could
taking
you bond with him?
no, and
Yeah.
that's another thing. I feel like our bonding did it was significantly delayed by postpartum depression. We had a very slow start, and even after things, you know, started to turn around, it still really slowed that progression of
Sure.
our bonding.
Absolutely,
But,
which has to be a psychological issue for you as well. That's
mhm.
that's sort of a vicious cycle that you're in then.
It is, and not only that, you know, wrecked with guilt that I was not being the mother to my other child that she deserved. You know, this was last summer, and she loves to go to the pool. She loves to go to the beach, and she was cooped up inside all summer. And still to this day, it breaks my heart thinking that she, you know, missed out, and I was not the mom that I could have been for her.
Amanda, was there a day that you woke up and you said, I think I'm better?
So it was day three of taking the Zurzuvae, and only a 2 week course. You take it right along with your antidepressant, which I was planning on continuing. And it was day three, and my appetite came back, and I was like, I can take a breath. I can feel feelings again, whether they're happy, they're sad, they're overwhelming, they're guilt. I could feel again, whereas before I just couldn't feel anything.
Sure, absolutely. You've
Hmm.
walked through this fire now. Tell me in retrospect now, has this changed your view on motherhood, or where do you stand now on all of it?
Um, it's changed my view that I think it's physiologically impossible for every woman to not experience a touch of this. And so just for my own family and friends who anyone's having children, I approach them in a much different way, offer support in a much different way. Just knowing that it this happens and it's not talked about, and I try and be that open space for for anyone.
Right, which is so fantastic. And was there a piece of advice that someone gave to you and it was well-meaning, but it just absolutely meant nothing at the time?
Oh, of course. I mean, everyone says, it's just the baby blues, you'll get through this. It's just hard right now. But they don't realize that physiologically there's something going on inside of you that we have no control over. And that medication that I took was like this hormonal reset. That's how I like to describe it. And it just completely brought me out of a funk and allowed me to become a mother and not just a caretaker to my child.
Yeah,
That's
absolutely.
what I felt like.
I'll bet you did. If there's a mom who's listening right now and she's having a hard time, what do you want to tell her? What should she do?
Social media is a huge source of support. I'm part of a couple different mommy groups on Facebook. If you feel the stigma, if you don't have someone to talk to, join these groups, not only for, advice, what's your favorite sippy cup? What products are you using? What's, the best nipple cream? You learn so much from these groups, but there's also a huge support of women who are there to share their own experiences, offer guidance, explain their own path to through treatment and recovery. And just know that you can comment and post anonymously in those groups. Mm-hmm. So if you are someone who doesn't feel comfortable speaking about this to anyone in your own life, there is a huge world of support on social media that can be there for you, anonymously or not. Mm-hmm. So that's my biggest piece of advice.
Well, Amanda, it looks like you're doing well, and I know those babies have a great mommy, and they're very lucky to have you. I'm sorry that you have gone through all that you have, but we certainly appreciate you sharing your story today. It's not an easy one to share, I understand.
Absolutely. Thank you. Thank you for providing this platform.
Absolutely. Amanda, thanks very much. We're going to take a break, everybody. When we come back, a representative from a postpartum support group will join us. This is Kerrigan and Company. Boston is full of smart, driven professionals whose lives are full, but their love lives, well, not so much. That's where Allure Matchmaking comes in. Led by Jill Vander, Boston's most respected matchmaker with more than 25 plus years of experience, Allure eliminates the noise of dating apps and replaces it with discretion, dignity, and high-quality introductions. Every match is thoughtfully vetted and personally selected. No public profiles, no endless swiping, and no guessing games. If you're ready to stop wasting time and level up your dating life, contact AllureMatchmaking.com today. Exciting news just keeps coming for my friends at Sienna Aesthetics Medical Spa. Besides their incredible new location opening in Marblehead in August, they're now introducing the Spectrum, an aesthetic laser that can offer customized skin treatments for a number of needs. Light therapy that treats signs of aging, collagen stimulation, pigment treatment, including the removal of tattoos, and hair removal. Spectrum is one of the safest and most effective lasers made for aesthetic purposes. Make an appointment now for the end of the month and get 20% off your first Spectrum service. Go to siennaaesthetics.com. This segment of Kerrigan and Company is brought to you by Bill Haney's North Shore Music Theater. It will be nothing but a good time at Rock of Ages, playing August 12th through the 23rd. Get your tickets at nsmt.org. Welcome back, everyone, to Kerrigan and Company. Very important topic today. We're talking about postpartum depression. We've been lucky enough to be joined by a doctor and by a woman who shared her story about her experience, which is not an easy thing to do. But, there are other people who are affected by postpartum depression, not just mom. Full families are affected. And we want to talk a little bit more about how families and partners and friends can support these women who may be walking through this. So joining us is Lisette Lopez Rose. And Lisette is with the Postpartum Support International. And of course, their job there is to try to increase awareness about this. And we're so glad that you could be with us today. Awareness, really, this is the big issue, isn't it?
It is. I think it's really, really important to know it's the number one complication from childbirth to experience a perinatal mental health disorder. And so I'm just so appreciative that we are able to talk about that with you today.
Well, Lisa, we were talking about it here in the studio, saying, unfortunately, we're in a society that if I've got a broken arm, then I'm going to get sympathy. But if you really can't see my problem, people have a tendency to be a little less sympathetic.
Yes. And I think that's what makes it so isolating to have this experience. It's like when it comes to mental health, you can't really see it, so to speak. And it's definitely something that's very real, and absolutely treatable with the right professional help.
I think, too, a lot of people just think that naturally babies come to the world and mom goes, I'm so overjoyed. I'm so happy you're here. And if you don't feel that way, well, what's wrong with you?
Right. And that's how I'm so appreciative that you bring that up because that's how I felt. I felt like I should be happy during pregnancy. I should be glowing, excited to become a mom. And I was quite the opposite. I was really scared. I was anxious. I wasn't sure if I was cut out for motherhood. Like those were real things that I was going through. And I couldn't tell people. It was an experience that everybody assumed where I was happy, and ready to become a mom, but really on the inside I was going through something really, really difficult, and I didn't feel like I could talk to people about it. And so there's so many women, so many birthing people that feel that same way, and I'm so glad that there's support that does exist, like postpartum.net.
Yeah. So let's talk a little bit about that because really what we want to address in this segment is what the people who love these women should be looking for. So, we're checking babies when they're born and we're getting to that 6 week checkup. And yeah, mom's asked a few questions, but mostly we're making sure baby's doing okay. What is it in the meantime that a partner, a husband, grandparents, friends should be looking for?
Sure. So there's a different like just there's a bunch of different perinatal mental health disorders, excuse me. It's a whole spectrum of different disorders, and so each one presents with unique symptoms. But I think the biggest thing is a lot of folks might be feeling sad or depressed, right? So I think loved ones can look out for like feelings of sadness, depression, maybe anxious or panicky feeling. Maybe they're having trouble sleeping or they're not eating. Maybe they are questioning, like how I did, of whether or not they are fit to be a parent. And then also looking out for one of the biggest things that we see now, and people talk about it now more, is like mom rage. So like intense anger, those mood disruptions where you're feeling a lot of anger or irritability. I think it's really important to kind of look out for those things that loved ones can pay attention to the person who gave birth.
Yeah. And Lisa, what can the support group do about this? How do they go about approaching it? I think if someone is feeling rage, the last thing you want is someone to say to you, oh, you're okay.
Yeah, so we definitely at Postpartum Support International, we are there to support each other, to validate our experiences, but we're not there to like fix or diagnose or try to give advice, right? And so I think it's really important that when these people that are reaching out for support come to groups, they understand that like it's a non-judgment free zone, right? So there's not going to be any judgment. We're there to support people's mental health. We're there to validate what they're feeling, and kind of normalize the experience because so many experience it and we can talk about it. It's okay to talk about it.
What would a postpartum mental health plan, through the eyes of your organization, what does that look like?
Sure. So, in terms of like for attending our support groups, you don't need a diagnosis to attend. So whether or not you have an official diagnosis from a doctor, that's not necessary to get support from us. So as long as like you're feeling isolated, you're feeling those potentially symptoms of like sadness, depression, anxiety, that sort of thing, you don't need an official diagnosis or referral to attend our support groups.
And are these support groups found across the nation?
Yeah, they're international. So we have folks joining from different countries. They're open, they're online virtual, so they're open to anyone. You just register on our platform, on our website. And so that's how you're able to attend our support groups.
Yeah. And talk to me a little bit about how those groups go, and do people just share ideas? Do they share experiences? What happens?
Yeah, so when you attend one of our support groups, our philosophy or our mission as a nonprofit is to really educate people. So we do go over some education about perinatal mental health disorders, things to look out for, because people could be joining us and just be like, I'm feeling kind of lonely, but I don't really know if I'm experiencing a disorder or not.
Right.
And so we definitely are heavy on bringing awareness and education. And so part of the support group is that part of education and hearing that information. But then at least an hour of our 90-minute support groups are for open discussion. And that's where folks can kind of talk about what's, heavy on their heart, what brought them to the group. Sometimes we'll have discussion questions or an image, does anybody relate to this image? And it's really just peers, the individuals showing up for each other, supporting each other, relating to one another. And then our support group facilitators are there to kind of help guide the discussion, but also bring any information, or they can also help validate anybody's experience.
Is it a group that you would suggest only moms attend, or could dad attend too?
Dads can attend. So we have so many groups. I think we're at like 40 or almost 50 different groups types that we offer. But we do have specific groups for dads. So we have dad support groups. But then we also have our general perinatal mental health support groups for parents. And sometimes that's where we'll see dads or even couples come together to a support group.
Yeah, it seems like that would be important because I feel like dad's going through something here too.
Yes, and I think it's important to throw out the statistic that 1 in 10 dads can experience postpartum depression, and 1 in 5 moms can experience postpartum depression.
And I know that that I've seen that stat, and I'm so glad that you brought that up because obviously dad is facing that for a different reason than mom. Mom's may be something hormonal, hers might be physical, but dad is also facing a big change in his life, sleep deprivation, all of those kinds of things that can come along with depression, right?
Yeah, absolutely. And for dads, they're the biggest support person for
Right.
the person that experienced birth or, went through pregnancy, that sort of thing. And so it's difficult for them too. And people need support too. And so they definitely are worthy of getting support.
Absolutely. What are the qualifications for people who are conducting some of these seminars and some of these support groups?
Yeah, so we have lots of volunteers who are super committed to making sure that our services are free. So that's something that I don't think I mentioned yet, but all of our support groups are free and our services are free. And our volunteers are what allows us to do this work for free. We have dedicated volunteers that come to us. We train them. We have a process of how we train them to make sure that they are set up to be able to facilitate those groups. And so we provide all the in-house training and then support them as they are facilitating groups.
Great. All right. So we've got moms, I'm sure, who are listening right now, and they'd like to try to figure out how to connect with a group. Would you tell them how they can do that?
Yeah, they can visit postpartum.net, and then you can find how to join a support group there, how to get help. But also, we have our warm line, our PSI warm line helpline that they can call and also get connected to the groups that way. Because I know it can be challenging to navigate a website when you're just not feeling well mentally. And so, Postpartum Support International has that helpline there to help out.
Lisette, would you say that if a woman has had a history of maybe depression in her life, she should start with these groups prior to delivering?
I definitely feel like in my particular case, I had depression before pregnancy. And I think it is a great start to go to groups while you're pregnant. We actually offer support groups that are for pregnancy mood support. But definitely, it's really important to know your risk factors. So there are specific risk factors that put you at risk for developing perinatal mental health disorder. And definitely having anxiety or depression prior to pregnancy or prior to conception, that does put you at risk for those disorders. And so I think the more information, knowledge is powerful. And so more information we have, I think is the better. And there's resources out there to get support.
You bet. All right. Once again, can you give everybody the website?
Sure, postpartum.net.
All right. Terrific. Lisette, thank you so much for being part of the show today. Very much appreciate your time.
Yeah, you're welcome. Thank you so much.
Absolutely. We're going to wrap things up in just a moment, everybody. This is Kerrigan and Company.
If you like rum, you're going to love Rumson's Rum, New England's most award-winning rum brand. Rumson creates distinctive and savory flavor profiles by hand-selecting and marrying the finest barrel-aged Caribbean rums. The spirits are then blended and finished in the New England Rum House. Choose from Rumson's Gold, Spiced, Grand Reserve, or Coffee Rum, which is smooth and sweet with a warm roasted coffee flavor, a hint of vanilla, and a decadent buttery finish. Find Rumson's at liquor stores or ask for it at your favorite restaurant. Learn more at rumsons.com. That's rumsons.com. Rumsons. Life lived, life enjoyed.
If you think a musical can't rock, think again. With the hits of Whitesnake, Styx, Journey, and more, Rock of Ages will rock your summer. Now through August 23rd at Bill Haney's North Shore Music Theater. Tickets at nsmt.org.
This segment of Kerrigan and Company is brought to you by Sienna Aesthetics Medical Spa. Take years off your face with the very latest technologies at Sienna Aesthetics in Beverly. Well, that's going to do it for this edition of Kerrigan and Company. For those of you listening, if you are someone who believes that you may be suffering from postpartum depression or any other kind of syndrome, first off, we just want to suggest that you immediately contact your doctor. Or if someone you love, you see some of the signs that you've heard in this episode, you're seeing that in that woman, then you might want to contact her doctor. We also want to give you that website again for Postpartum Support International. It's postpartum.net. That's where you can turn to find a support group if you're in need of one. Thank you so much for being with us. If you're watching us on YouTube, I hope you'll subscribe. And if you're listening on any other platform, we hope you'll like us and subscribe there as well. And if you're not following us on social media, we hope you'll do just that. We'll see you again next week. We hope you enjoyed this episode of Kerrigan and Company and that you'll tell a friend and keep us company by following the show on Instagram, Facebook, TikTok, and X. If you've missed any episodes, you can watch the show on YouTube or listen to it on all major podcast platforms. The executive producer of Kerrigan and Company is David Thompson. Our engineers are Ben Kitchen and Tucker Silva. See you next time.